So usually I try to do subjects that are controversial, like evolution or morality or essential oils, but I have a patron named 29 who suggested this subject, and it caught my attention, so I figured I'd do a video on it. Still a science subject. Today we're going to talk about spinal injuries. We'll start with the anatomy of the spine, then we'll talk about types of spinal injuries, and finally we'll talk about treatments, historical and modern. Okay, let's get into it. Let's start by talking about some anatomy. I imagine lots of people watching this will already know a lot of these terms and how it operates, but I figured it was best to define everything, just in case there's somebody out there who doesn't know one of the definitions. The topmost level of the spine is called the cervical spinal cord. That's where the spine connects to the brain and extends from vertebra C1 to C8, with C1 being the vertebra closest to the brain. The C in C1 stands for cervical. Then below that is called the thoracic spinal cord. C8 connects to T1, which is the first in the thoracic section, all the way down to T12. The root word of thoracic is thorax, like a bug's thorax. Your ribs are connected to the T vertebrae. And FYI, I heard this myth when I was younger, that women had one fewer rib than men do, and it was because Adam had the rib taken from him to make Eve. That's complete garbage, so don't buy it. Humans have 12 pairs of ribs. Some humans have 11 pairs, some have 13 pairs, but the norm is 12. So as I was saying, below the 8 cervical vertebrae are the 12 thoracic vertebrae, and below those are the 5 lumbar vertebrae, called L1 to L5. The lumbar section of the spine curves inward a little bit. The sacral spine is in the triangle-shaped part at the base of your spine, and it curves outward a little bit and connects to your coccyx. I probably pronounced it wrong, but that's how I've been saying it since I was in anatomy class, so suck it! Between each vertebra is a disc that acts as something of a shock absorber, so the bones aren't grinding together every time you take a step. When somebody gets degenerative disc disease, which my dad and my brother have, it means the discs between the vertebrae are thinning through wear and tear, and it's supposedly extremely painful. Sometimes it can be fixed through non-surgical means, but other times surgery is the only option. Then we have spinal cord nerve roots encased in bone throughout the spine. Okay, now let's talk about types of injuries. Spinal cord injuries are split into the categories complete and incomplete. In the case of incomplete injuries, the spinal cord is only partially severed, which means the person retains some function. The amount of function retained depends on the extent of the injuries. Complete means the spinal cord is completely severed and the person retains no function. In some cases, physical therapy and treatment will allow people to regain some function after a complete spinal cord injury. And as a side note, I'm not giving up hope on anything. Science is an amazing process, and I believe we can accomplish almost anything given enough time and research. So I'm not counting out people with complete injuries just yet. Anyways, let's take a look at some of the most common types of incomplete injuries. To start, we've got anterior cord syndrome. Anterior meaning front. It's the most common form of what's called spinal cord infarction, or tissue death due to loss of blood supply. It happens when the front part of the spinal cord is damaged. It prevents blood flow in the front 2/3 of the spinal cord, and something called the medulla oblongata, which controls automatic functions like breathing, blood pressure, and sneezing, interestingly enough. With anterior cord syndrome, you lose all motor function below the injury, and you lose the ability to feel pain or temperature. However, you do retain the sensations that are carried by the back of the spinal column, including vibration and your sense of where your limbs are, called proprioception. It's what makes it possible to close your eyes and touch your nose with your finger. The human body is a seriously incredible thing, isn't it? Then we have something called central cord syndrome. The last one was the most common form of spinal cord infarction. This one is the most common incomplete spinal injury. As the name implies, it's an injury to the center of the spine, usually the result of neck trauma. You usually lose function in your arms and hands. Sometimes people lose a little bit of control in their legs, bladder, or sexual function too. It usually happens to older people who have degeneration in the cervical section of their spinal column, called cervical spondylosis. Next we have have Brown-Séquard syndrome, forgive the pronunciation, which happens when the spinal cord is damaged on one side. Whichever side of the spinal cord has the injury, that's the side of the body that'll be paralyzed, and sufferers also lose proprioception. As mentioned a minute ago, that's what lets you sense where your limbs are. On the opposite side of the body, you can't usually experience pain or temperature, but you have motor control. The condition was named after the physiologist who originally described it in 1850, Charles Edward Brown-Séquard. I know I f***ed that up, give me a break. Now let's talk about the most common types of spinal injuries. We'll start with tetraplegia or quadriplegia. It can be caused by an illness or injury to the cervical spinal cord, which means the spinal cord anywhere above where your top rib connects. And it usually means complete or partial loss of function in all four limbs and the torso. It can result in loss of bladder control, and it can also affect breathing and other autonomic functions that take place in the torso or lower body. For example, someone with an injury to the C1 vertebrae will probably lose all function from the neck down and require a ventilator. But somebody with a C7 injury will probably be able to breathe on their own and might be able to retain some use of their arms and hands. Then we have paraplegia. That's usually caused by injury or a congenital condition, meaning they were born with the defect. Paraplegia is loss of function and sensory information in the lower half of the body, like detecting temperature or pain or whatever else. As with all spinal injuries, how severe the symptoms are varies wildly, and it's usually linked to how severe the injury is in the first place. This type of injury is pretty common for soldiers, and like quadriplegia, it's caused by damage to the cervical spinal cord. Next is triplegia. It's a lot like the others, but it only affects 3 limbs. Usually it's 2 legs and 1 arm, but it can happen with 2 arms and a single leg. And finally, we have thoracic spinal injuries. That means the spinal cord is damaged within the thoracic region, or around the vertebrae that attach to the ribs, T1 to T12. These aren't usually fatal, but it could really change somebody's life. People with this type of injury are usually paraplegic with use of their arms, chest, and upper back. It might affect one or both sides of the body. One major way this is different from cervical injuries is that thoracic injuries probably won't affect the upper body, so usually autonomic functions like breathing are unaffected. The biggest problem for a lot of patients with this type of damage is loss of bladder control, but it's usually easily managed for most people. The T1 vertebra is the highest one, which will still allow complete function of the hands. Okay, on to treatments. Let's start with the historical treatments. Paraplegia was described in the Edwin Smith surgical papyrus around 3000 BCE in Egypt. It mentioned that paraplegia was caused by spinal injury. Around 460 to 370 BCE, Hippocrates was the first to describe a way to treat or reduce the injuries through traction, or carefully and slowly pulling on a fractured or dislocated body part. Jesus! I will pass on that one. Paul, from a city in Greece with the terrible name of Aegina, lived from 625 to 690 CE, and he used a windlass, which is a type of wrench usually used on ships, to reduce dislocation and recommended surgery to remove some of the vertebrae. He also recommended a manual extension to reduce pressure on the spinal cord and treat a fractured spine. Of course, that specific treatment is from over 1300 years ago, and we have medical procedures today that have been tested and proven to work. But chiropractors still use that old way today. Don't even get me started on chiropractors. I covered essential oils, I covered a little homeopathy, chiropractors are on the list too, and acupuncturists. I'll get to them. But to be fair, traction is still used today in real medicine. Anyways, in 1230 CE, Roland of Parma used medical extension to treat fractured spines and started advocating for one of the most important things in the modern handling of spinal injuries: early treatment. Some of you might notice I'm referring to these people by their name and the city they're from. Roland of Parma, Paul of Aegina. That's because surnames didn't always exist. A quick side note, I'm sure some of you noticed that the Bible didn't give us a last name for Jesus. Surprisingly, his middle name isn't Hubert and his last name isn't Christ. China's been using surnames since around the 2nd century, but they hadn't really caught on at that time and in that area. That's why I'm not citing their last names. As I was saying, post-Renaissance, Ambrosia Paré, who lived from 1564 to 1598, recommended laminectomy, or surgically removing vertebrae, for spinal injury, which, if you remember, was also suggested by Paul of Aegina in the 600s CE. And that brings us up to the 1800s. The UK developed teaching hospitals in London, which produced 2 surgeons who got interested in spinal injuries. The first surgeon was Ashley Cooper, 1768 to 1827, who described all the manifestations manifestations of a spinal injury in detail, and wrote that his teacher, Henry Klein, had performed the first surgery to remove vertebrae. Probably not true since it's been a recommended treatment since 640 CE, but I couldn't find any sources refuting it. Maybe the first successful laminectomy in modern times. The second surgeon from the London teaching hospitals was named Charles Bell, 1774 to 1842. He was really opposed to laminectomy. He and Ashley Cooper, quote-unquote, indulged in a celebrated controversy. Bell noted that damage and swelling happened at the moment of the injury and continued pressure wasn't the problem. He said surgery was risky and pointless. He also said the efforts of the doctors should be focused on diagnosing the problem quickly and accurately. So that puts us in the modern era. Diagnosis of a spinal injury today might involve an X-ray, a CAT scan, an MRI, or a combination of them. Diagnosis might not be possible until swelling goes down, usually a few days after the injury. At this moment, there's no way to reverse spinal cord damage, but research is being done on prosthesis and medication to promote nerve cell regeneration and function. And like I said earlier, I will never give up hope on science and its incredible ability to push us forward. There's somebody out there with a need, and the money and interest to research solutions for that need. It just takes time. Anyways, early medical attention is the most important factor in minimizing damage. With physical trauma, the spine has to be immediately immobilized. Some techniques to immobilize like that include rigid neck braces and carrying boards, since the spine can still bend with soft boards. I mentioned traction earlier, the technique from the 600s that chiropractors still use today. That specific technique is actually still used in real medicine, not just chiropractic, to ensure bones are aligned correctly. Sometimes surgery has to be performed to remove bone fragments, herniated discs, broken vertebrae, or to implant rods or other stabilizing stuff. Inducing hypothermia for 24 to 48 hours is an experimental treatment to prevent tissue inflammation. There are constant clinical trials for medicine that's supposed to reduce damage, both immediately after the injury and for people who've sustained past injuries. So don't give up hope. Never give up hope. You might be told that this is going to be your life until the day you die, but there's always somebody out there with the desire and the bank account to figure the problem out. It isn't about whether or not it's possible, it's about how many people we can put on the team to figure out how to fix the problem. Never, never give up hope. Anyways, that's all I've got for you. Join my Discord, check out my Patreon, and check me out on all social media. All links are in the description as always. Thanks for watching, guys.